Hello, this is Rashi Sahai, and you're watching MediCircle. Today, on our cancer awareness series, we have Dr. Nagraj with us. Dr. Nagraj is Chief Radiation Oncologist in Nanavati Max Super Specialty Hospital, Mumbai, and MD at AIMS. For the past 45 years, he has been working in this field. Welcome to MediCircle, Dr. Nagraj.
Good evening. Yeah, maybe it's good evening. Yes, that's hello. Pleasure to be here.
So, doctor, estimates indicate that India's reported cancer incidence in 2022 to be 19 to 20 lakhs, whereas real incidence is 1.5 to 3 times higher than the reported cases. High proportion of cases continue to be detected at late stages for major cancer types in India. Nearly two-thirds of the cancer patients detected radiotherapy, translating into 8 lakh patients per year in India. And high burden of cancer incidence in India is resulting in a high economic burden on account of productivity losses and premature mortality. So, doctor, my very first question is that what is radiation therapy?
Okay, now you did give interesting statistics as cancer is on the rise, but still not as alarming as the COVID was. Having said that, we need treatment, and radiation oncology or radiotherapy plays it's an important cog in the wheel of multidisciplinary treatment. More than 60 to 70% of the patients need radiotherapy at one or the other time. And there was a time, as I said, mine has been a very long journey. When I started my journey, probably in the 70s, late 70s, one felt that if the patient is sent to radiotherapy, that's what you do just before dying. It's not so anymore. And many of the early cancers, especially, are amenable to radiotherapy alone, and they can be potentially cured or controlled for a long time. Say, for instance, vocal cord. Very early lesion in vocal cord, you don't have to operate anymore. You can just give radiotherapy, or cancer of the cervix very early, or if it is very, very advanced head and neck cancer, for instance, you need to have chemotherapy along with radiotherapy. So this various combination with permutations with radiotherapy has helped either to cure, control, or more than anything else, to preserve function, to enhance cosmesis. These are all the very important achievements of integrating radiation therapy with other modalities, such that you maximize the outcome and don't affect the function too much, and also take care of the cosmetic outcomes of the treatment. Because at the end of the day, we are all human beings. We would like to look as much as we would like to be happy and healthy.
Yes, doctor. So, is radiation therapy and chemotherapy the same?
No. Radiation therapy is based on ionizing radiation. It's something like your X-rays. On the contrary, chemotherapy they also kill cells, much like radiotherapy, but their mechanisms is different. They're administered either intravenously or orally or various other routes. They are drugs in their chemicals, whereas radiation is a physical modality of treatment. They fall in the same electromagnetic waves like sun, X-rays, infrared rays, something like that. Okay, there are distinct modalities of treatment.
Okay, doctor. So, how safe is radiation therapy as compared to chemotherapy?
So I don't think they should be compared in that way. As I said, it's a multidisciplinary treatment. We have surgery, an important role. Chemotherapy plays a very important role in hematological malignancies, radiotherapy in most of the malignancies. Sometimes you give it alone, sometimes even combination. Now we have immunotherapy, hyperthermia, that is heating, combine heat with radiotherapy, so on and so forth. So the radiotherapy, you can say, is one of the effective physical modality of treatment, very, very distinct and different from other modalities of treatment, and is useful in more than 60 to 70% of the cancer patients in the journey, either to cure or control or palliate.
Yes, doctor. So, can radiation therapy cure or detect any type of cancer?
Yeah, I told you at the very beginning. Yeah, things have changed. Yes, there are certain tumors, like especially ocal cord lesions, cervical cord, and some of the very, very early lesions. Yes, of course, you can use singly as a single modality to cure the treatment. Yes, there's not anymore for the palliation. 40 years back, yes, maybe we were a little apprehensive, but now with change in technology, better understanding, all of that together, either singly or in combination, it can ensure cure. Yes, in some subsites and some kinds of tumors.
Yes, doctor. So on MediCircle, our main focus have always been to provide the audience with large amount of information in less time. And so today we will be conducting a small question answer session in which you could answer in 1 or 2 line sentence.
Sure. Yeah, you want me to answer some questions?
Yeah. So doctor, my first question is that is radiation therapy pain free?
Pain free. Oh yes. Okay. Radiation pain. Oh, yeah. So when radiation is like X-rays, all right. There's no heat that is generated. There's no pain. It's invisible ray, so there's no pain at all. There's no heat that's generated. Absolutely pain free. Yes, it is.
So does radiation therapy have any side effects?
Yes, depends on the site. Say, for instance, if I'm treating abdomen, there will be a lot of nausea and vomiting, etc. Or there can be, if I'm treating a very large bone marrow, then maybe the blood counts may go down. If it's a site-specific side effect. There are two types of side effects: acute and delayed. Most of the acute side effects can be managed, and by manipulating the way you give radiation, even the late side effects can be managed. And there's no treatment in the world which is free of side effects. Most of the side effects are acceptable and treatable.
So is radiation therapy affordable for general people?
Okay, and that's a difficult question to answer. It depends where you go. And well, I think by and large, yeah, it has become a little more expensive these days with the recent technology. But I think it's least expensive, much less expensive than surgery and chemotherapy. Uh, Economics is always a bit of a problem. Yeah, I think. Well, I think it should be. Yeah, it's far less expensive than, say, for instance, immunotherapy or some of the targeted therapies or some radical surgeries. Yes, it is affordable, but we need to have a lot of public funding. Government should start and set up a lot more different kinds of technology which is suitable for uh, various cities and towns. It is affordable, but you've got to make it more accessible and affordable. Yes.
Okay, doctor. Thank you so much for coming to our
Thank
show
you.
and sharing your valuable time and insights with us. It has been a
Thank you.
pleasure having you on the show. Thank you.
Thank you.